At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Peripheral Neuropathy on Wednesday, December 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Sunday. This is Dr. Tom, and it's a beautiful day outside. You better get out and really enjoy it if you're in the Washington metropolitan area. It's one of those kind of perfect fall days. So, go for a walk, do whatever you want to do, but make sure you take me with you. Today's program is going to be one that is not only interesting, fascinating, but for me, it's puts a smile on my face because I get to do it with a friend and somebody who I truly am impressed with his background, the capacity, the things that he does. And we're going to be talking about temporomandibular joint dysfunction, but also I'm going to spin off on that. I'm probably going to tweak the chain on a lot of things you hadn't thought about, but we're going to go from here right into the live stream and we'll continue to be together. But my guest is Dr. Michael Chung. He is the head of soft touch dentistry in Oakton, graduate of School of Dental Surgery and Dentistry at University of Maryland, and also a graduate of an organization that I hold in great respect and esteem, and that's LVI, Advanced Dental Studies Division of Comprehensive Aesthetic Reconstruction. It's in Las Vegas, typically called LVI. Having said that, Dr. Mike, welcome to the program. It's been too long.
Thank you for having me. It is my honor.
Mike, when we get into this subject of temporomandibular joint dysfunction, if you will, TMD as it's often called, in my world, I see a lot of different miscorrections. We'll start with that. I'm trying to be as kind as I can possibly be. I'll give you an example. The other day, not the other day, good time goes by, probably about 10 months ago, this young woman comes in. She's 19 years old. She's been in braces since she was 12. And she has a genetically shortened lower mandible. So what they did with her, starting at 12 years old, they started pulling the mandible forward instead of doing surgery, putting a spacer in, and then doing it the right way. So when she comes in, this kid's got all kinds of problems, from migraine headaches and even aberrant menstrual cycles that seem not to be a result of other things. And when we did the x-rays on her, her right condyle was totally eroded because of the pressure of moving it forward. And you know me, I don't hold my tongue too lightly. And I said things that, and I told her, I said, you need to see somebody to get this done the right way, but I don't know if that condyle will ever be restored. It's a possibility if we can get it into neutral. But let's jump into it. What I'm basically saying is that there's so much that can be done to correct bad applications. And that's why I sent them to you, because I know you know what you're doing and you do it the right way, from kids who have had braces put on the wrong way and they have spinal curvature and so forth. Mike, walk us through the significance of what can symptomatically can a bad temporomandibular joint dysfunction show up as? It's not somebody's going to point to the jaw, but what are the symptoms that kind of accompany that? What would give you the heads up?
Temporomandibular dysfunction can cause all sorts of problems, as you know, and it basically will go down your whole skeletal system. The whole nervous system can be affected by this. But usually the first signs of symptom the patients come in for is because they're having pain in their jaw, they're grinding, they're clenching. They usually will say they're getting clicking or popping in their joints. And headache is a main symptom for a lot of these patients. And a lot of them come in with neck issues as well. And so there's a strong correlation between TMD and neck pain and as you mentioned earlier, radiates down all the way down to their whole spinal system where they can cause scoliosis. So it is definitely a condition where we need to put the patient back into physiological balance, where it's not just the teeth, but it's also, the correct jaw position and the alignment of their temporomandibular joint.
Mike, I've been in practice a whole lot of years, coming up in April 1. It's been 48 years. Many, many, many moons ago, I think I'd been in practice a couple years, 2-3 years, young girl comes into the practice, and she had a very significant scoliosis after the fact. And I'll give you the position on this. So parents would come in, family comes in once a month. We would adjust them. We would take care of them, structurally balanced. This girl was a gymnast. But she was going to have braces put on that summer, and she went to grandma's house, and I wouldn't see her again for about 3 months. But the dentist, knowing that she was going to be away and he wouldn't have the opportunity to watch her, look at her, he tightened the braces down much more so than what he would normally do. So here's this girl, 2 months later, she comes back, about probably 10 weeks later, comes back in the office from a perfectly straight muscular spine. This girl now has a 27-degree spinal curvature, from nothing to 27 in 2 months, in a week or two. And being a young doctor in practice, I kind of say, oh my God, what's going on here? So I called a friend, Mike Marfino at University of Buffalo Dental School, who's also an applied kinesiologist. And I said, Mike, this is what I have. And he said, just calm her down, send her to me. And he says, I'm going to take the braces off. You do your work with cranial reconstruction, malposition, and so forth. And so we did it, with the right positioning, and God willing, and we were hoping to get results. And then 4 months later, she had a perfectly straight spine again. But if we hadn't caught it, the erosion, the molding would have been awful. What I bring that up simply this, and this is something you are very careful with. Many dentists match the teeth for vertical dimension instead of considering the TMJ first. When they do that, in your opinion, how bad is that? Is that something, well, don't worry about it, it'll reposition, or is it something that can cause a cascade, an avalanche of symptoms besides the one that I just told you about?
Well, fortunately, the human body is very adaptable, and even with malocclusion, a lot of people seem to get by day to day, but eventually it can catch up to the patient. You can have all sorts of symptoms down the road. You can have complete arthritis of the one or both of the TMJ joint. You can have, usually will cause the patient to have lordosis, which is the reason we need a partnership with a great chiropractor like you. But the patient will have many, many symptoms that will go down to their whole skeletal system, even, down to even digestion. I mean, it can affect so many things of the human health that it is crucial that they're in the correct physiologic occlusion.
It's amazing to me when you talk to physicians and dentists and even guys in my world that don't do the kind of work that I do, that they're not aware of the exponential ramifications that can occur when the TMJ is not positioned properly. You have, obviously you have muscles in there, you have masseters, and you have these hinge muscles called pterygoids. But sticking just with that, when that joint is not aligned properly, it's going to affect the 10th cranial nerve. It's going to affect the vagus because it exits right there, right behind it. And it goes all the way down. And that vagus is the master control virtually of every organ system in the body. So if there's reflexive pattern where that TMJ is not sitting, you got 22 bones that make up the head, it's going to have a profound impact on that vagal pattern subsequently. So in your world, when you see people like this and they walk in and they have, in the second half of the program, when we go to the live stream, I want to talk to you about tinnitus and things like that that are very directly related to TMD conditions. When somebody comes in and they're complaining about whatever it is, my heart's flipping around, I'm getting these shortness of breath spells, I have this coughing and so forth. When do you begin to suspect that, one, it may be a TMD problem, that temporomandibular joint is not sitting properly, that in fact the evidence holds that it may be causing these things that the patient's complaining of?
Well, first of all, we do a fairly comprehensive questionnaire where we ask a bunch of questions about, many symptoms in the head and neck area. And then I also evaluate usually their head posture, their symmetry of their eye level and their face. So we and the other thing that we'll do is if I suspect that TMD problems, then we will also take a cone beam scan of the head and neck area so that I can see all the anatomy and all the structures of the airway and joints and their teeth. And usually we can also look at how they're speaking, their neck posture, as well as usually the vertical dimension that you mentioned earlier. So we have to look at various different symptoms and clues that we put together to suspect that. And usually we can come up with pretty good, diagnosis by the end of all those questions.
I was in Toronto about 2 weekends ago, and I was teaching at a group called Swiss. It's the Society of Power Builders, Weightlifters International, blah, blah, blah. I'm not sure all the credentialing on it. It was about, somewhere between 550 plus guys that were sitting there. They're trainers, they're doctors, there's dentists and so forth. And I taught 4 sessions. The last part of the program, at the end of the day, I taught very specific muscle function identification, but it was started with upper extremity. And what I showed them was that not all inhibitions and muscle weaknesses and pain are at the joint level, meaning the shoulder, the elbow, the upper back, the neck, and so forth. And I showed that the temporomandibular joint, particularly the hinge muscles, the pterygoids, have a huge impact on range of motion and body function. So I had this patient, I picked him out of the audience, and I asked for somebody who had limited lateral abduction. And this one power lifter came up and literally only had probably about 30 degrees of lateral abduction. And I asked him, I said, do you mind if I check this out? And he said, no. So he gets on the table, and I had a light percussor. What I did, and I went directly to it because I wanted the impact, I put a finger cut on and went into the saddle of the temporomandibular, or the pterygoid, the middle pterygoid, and just used the percussor on my hand about, probably about a minute. And then I stopped and I took his leg, and from maybe 30 degrees, now he had pretty close to 90 degrees lateral abduction. So
Wow.
What we're seeing is that temporomandibular joint, if the neuromuscular pattern is not balanced properly, and if it's not identified properly, or if it's made worse by people, as I said earlier, that are balancing the dentitia instead of the joint itself, you can exacerbate and make things far worse than you would otherwise. And so my question to you is this, not that you would have asked the question, but has a patient ever come into you and say, doc, once you fix that TMJ, and I've been everywhere, I have, I don't know why my back pain went away. I don't know why I'm able to, to do more. It's been bothering me for years, and you were able to resolve it.
It's amazing. Some of those symptoms, I can't explain it either, but we do know there's a strong correlation between the physiological occlusion, the correct joint position can affect so many symptoms. I mean, we had patients that after treating their TMD, all of a sudden got their hearing back. We had patients that had eyesight issues and their vision got better. I mean, it affects the musculoskeletal system, in a way that is very profound. And it's beyond, my education level. Maybe you can explain some of that, but I do know that when I treat their TMD and it's successful, a lot of their symptoms that they think are not related to the TMJ is resolved. And also, of course, we share patients because you're able to help them in ways that I can't help them. So it is a wonderful thing for the patient. But obviously, I never make promises, but it is a treatment that's well worth looking into.
It's interesting. One of the things I do and I demonstrate, and when I've been in, I come to your office and I'll get a little cranky day from day, and I'll show you a couple of things. I'll show you girls something. But at the same conference, there were a couple guys that they were complaining that their power had gone away, and I asked them some question about their dental health, and this one guy said, "Yeah," he said, "I don't know what's going on. I went to a dentist and I had some work done. I don't feel any discomfort." So I tested him. What I had him do is I had him stand up and I put him in the position that he normally was going to lift, and I tested a muscle. And I said, "Now make believe you have it." So I saw his jaw lock down. So many people do that. They just close tight, and he weakened all over the place. Then I took a tongue depressor and I put the tongue depressor between his teeth. And I said, "Now don't bite on this thing, just hold it." And he went back, and they had weights, obviously, heavy weights there. And the guy goes in and he gets a hold of the barbell and he lifts up, and he could do what he couldn't do before. The temporomandibular joint causes a profound impact. So, when I send somebody to your office, I know that, one, you're going to do it the right way, and you get that vertical dimension squared away properly. Now I got a patient that can heal, they can resolve other issues that normally we wouldn't be able to, or if we had to do it, was going to be slow process, and then maybe only get 80%. Now I get 100% resolution. Mike, talk to me about a little bit, and I'll get into it a little bit when we get into the live stream. I want people to see it when they follow us after the program. And by the way, I want to remind everybody that all you have to do is to go to the live stream. As soon as we're off here, we're immediately going into the live stream. Go to drtomroselle.com, DRTOMROSELLE, drtomroselle.com, and you'll see a banner. Click it. It'll take you right in. If you're following me, which I hope you are, on any of the social media sites, we'll let you know. I mean, it immediately goes to your phone, and you say, we're live, and so forth, whether it's Facebook or Instagram or X or any of them, we're there. And so make sure that you follow us. And I promise you, we're going to have some fun as we're going, because I want to talk about, this cricket sound and this high pitch stuff and this low pitch stuff and the things that, and we touched a little bit about it in the beginning of the program, and how the heart as well is involved in all of this. Mike, just kind of a lead in to what we're going to play with a little bit, and you've heard me talk about it before. In Chinese medicine and Eastern medicine, every tooth in the mouth has a correlation to organ systems and very specific spinal levels. And when, I don't know how much you may have gotten into it or not because, of my tweaking here and there, but when you see a patient that has a bad occlusion, that their TMJ is off, and it's significant and it's there, what do you notice relative, or what might make you suspicious that they're going to have other potential organic conditions?
Well, every patient is different, so I don't know exactly, if they will have one or more of the symptoms, but and so my job is always to find the correct physiologic occlusion for the patient, and the detailed questionnaire before and after usually will reveal what symptoms have gotten better, or maybe some that could actually get worse, and that puts us to the point where I need your help sometimes to get the whole balance of the whole patient holistically. But my job is to put them in that correct neuromuscular position.
There was a real interesting article that I came about when I was teaching out in Chicago this last year, and it was the relationship between temporomandibular joint and heart problems. In the article went on, it says not fully understood from a normal look at situation, but when you start going back to what I kind of touched upon with the vagus nerve, because the vagus nerve goes directly to the upper chambers. What we've seen, well, what happened, I've talked about what happened to me back in March of 2020 when I was coming to see you, but you had closed up, and I was sitting at the light in front of your office, and a young lady decided to plow into the back end of me at 55 miles an hour, snap my head back, and they take her off to the hospital. But what the problem was for me at that point is my heart started going into fib. And we treat it all the time from my threshold, but what it had to do with was, I had looked to one side, my TMJ got locked down, my neck was extended backwards, that vagus got crunched, the upper chambers of the heart started to misfire until 6 weeks later when I passed out. So, we're going to touch upon a little stuff. The TMJ is so fascinating to me because it has basically more neurological input from that joint any place in the body. And, I love when I send you people because you get it fixed for me where I can do the rest of the work and get it done the way it's supposed to get done. Listen, Mike, we're coming up. We've got about a minute left, and we're going to go directly to the live stream. Hope everybody will follow us through. You get to see Dr. Michael Chung, and as I said, great friend, but somebody who I really appreciate relative to his capacity, his expertise, his ability to understand the dimensional consideration of that. So join us right away, and we'll get it done. It's an important process. It's something that I realized years ago when I was young in practice, that this temporomandibular joint is not just clicking and not feeling good, but it has a huge impact across the board. But anyway, go set it up right now. Join us in about 10 seconds or so, and we'll be right there. We're going to continue the process. And remember, I'm here every Sunday for one reason only, to give you all the information that you deserve, and ongoingly, so you can ask the right questions of your physicians, your doctors, your dentists, your chiropractors across the board. And remember, one reason only. I love you all. See you next week.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Peripheral Neuropathy on Wednesday, December 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.